Hi everyone, my name is Valerie, and today I'll be presenting my global health project, and my topic is reducing hypertension in low-income communities in northeast Brazil. So my geographic area is Teresina, Piauí, a capital in northeast Brazil represents an area where many patients face social and economic barriers affecting prevention and blood control pressure. Some of the common barriers include poverty, lower education levels, limited access to preventative care, food insecurity, transportation challenges, and difficulty affording or consistently taking medication. So hypertension in northeast Brazil, WHO identifies hypertension as a major global health problem. Reported 4 out of 5 people with hypertension are not adequately treated. Major risk factors are for stroke, heart disease, kidney disease, heart failure, and premature death. I based my research off a recent study in low-income communities in northeast Brazil found that high prevalence of hypertension at 43.6%. High sodium diet, obesity, physical inactivity, tobacco use, high alcohol use, stress, and limited preventative care. Poor control increased the risk of this preventable complication. So the historical perspective, it was discovered in the late 1800s that hypertension became recognized as a serious health problem by researchers connecting high blood pressure to stroke, heart disease, and kidney diseases. Past approaches, patients often received care only after serious health events occurred, and care was more reactive and hospital-based. And in 1994, Brazil expanded primary care through the family health strategy. Current approaches for hypertension are treated through preventable care like early screenings, lifestyle changes, reducing salt intake, medication adherence, and increasing physical activity. So the epidemiology and rates as a basis for comparison, in Teresina, the study showed the prevalence of systemic arterial hypertension among adults and older adults was 43.6. This rate is higher than other Brazilians. Estimates mention that the article, including approximately 24 of Brazilians reporting as hypertension diagnosed in 2019 and 27% reporting a medical diagnosis of hypertension in 2022. So web of causation is low income with a combination of low health literacy increases, fewer health screenings, and delayed care. Diets high in sodium and processed foods with physical inactivity increases obesity, diabetes, and increased blood pressure. Limited access to follow-up care and medications increases uncontrolled hypertension. And then uncontrolled hypertension increases the risk of stroke, heart disease, kidney disease, and disabilities. So impact on society and economy on Teresina is the financial impact. Hypertension can cause an increase in hospitalizations, medication costs, dialysis needs, emergency care, and loss of income when family members become too sick to work. Community impact: low-income communities experience a cycle where poverty worsens hypertension risk, and hypertension complications worsen poverty through medical costs, disabilities, and reduced productivity. Some of my treatment and prevention include community blood pressure and screening follow-ups. This could be utilizing primary care clinics, churches, schools, and community health workers to screen adults regularly. This is important because hypertension is often silent, and early detection can prevent further complications like stroke, heart disease, and kidney damage. Standardized treatment and medication adherence support. Use simple treatment protocols, affordable blood pressure medication, reminders, community health workers, follow-ups, and the WHO recommends treating hypertension through primary care. And then prevention through lifestyle and food changes. We're going to provide culturally appropriate education on reducing salt, limiting ultra-processed foods, increasing physical activity, and managing diabetes/obesity. So in Teresina, the study of hypertension was associated with factors such as diabetes and high BMI to support the need for prevention beyond medication alone. So, culture's issues to consider is food culture and affordability. Education should respect traditional Brazilian foods and focus on realistic changes such as using herbs and spices instead of excess salt and choosing affordable, minimally processed foods if possible. Trust and communication programs should use local health workers to understand the language, culture, and barriers of Northeast Brazil. This can improve trust, follow up, and medication adherence. And then we're also going to avoid blaming individuals. Prevention programs should recognize that people may rely on cheaper processed foods or missed appointments due to transportation barriers, work schedules, or limited health literacy. WHO and International Health Agency involvement. WHO created the HEARTS technical package. This helps countries improve cardiovascular disease and hypertension management in primary care through lifestyle counseling and evidence-based treatment and team-based care. PAHO suggests HEARTS in America. So this is a regional initiative to make cardiovascular risk management, including hypertension, diabetes, and dyslipidemia, as a standard part of primary healthcare across the Americas by 2027. And this is all my references.